Hi, I'm Dr. Burkholder with Olympic Concierge Medicine here in Tampa, Florida. I'm the medical director of the company, and I help patients who are young and old live healthier, longer, stronger, more fulfilling lives, right? So I'm a board certified ER physician, and I transitioned to concierge medicine, and I love it. It's a great way to practice medicine. And there's been a lot of questions for me amongst my peers and people outside of medicine. Hey doc, how are you using AI? And that's a very valid question. It's definitely changed how I practice medicine. There's these AI agents that can help me access information that would have taken me hours to find previously, and a lot of stress in the process trying to figure out and read through hundreds of pages of research sometimes. Now I can find that out in literally 5 seconds, 30 seconds. So it's really a game changer. My notes are done via AI now. And but there was this law that was passed back in the 90s. It's called the HIPAA law, right? So it's the Health Insurance Portability and Accountability Act, and that made that protected patients' medical information, but it made our lives as healthcare, as doctors and healthcare organizations, very difficult in the sense that there are very strict rules that we must follow in order to keep patients' information private and confidential. And there are all sorts of fines if we go against that and we divulge patients' information without asking them for that permission. And I think the idea is that AI can help us do so much in so many areas, especially in healthcare. Like I said, we're already seeing it. It's already changing my practice. But the question is, what would be an area that could be a problem? And HIPAA comes to mind, right? The HIPAA issues come to mind. And so when you're using AI to implement into your practice, the question is, what would be something that would kind of stop our use of AI as physicians and healthcare organizations? It's if the AI doesn't have proper privacy and security and confidentiality safeguards, right? If all of a sudden our AI is taking all of our practice information and then disseminating that across the globe, I mean, that could be a massive breach of privacy and massive lawsuit. So we don't want that at all. Not to mention, I mean, patients feel violated, right, if their medical information gets out there. It's a very private thing. And so I imagine that Congress, as well as these AI companies and large healthcare organizations, are working together with the AI teams and infrastructure to make sure that the HIPAA compliance laws are, in line with what AI is providing, right? So I think that's kind of the main thing is if you can find, if you're a healthcare provider and you're looking for AI to help your business, I think one of the main things you should be focusing on is, okay, this is great, the AI can help us do X, Y, and Z, but does it have strict guidelines and vetted guidelines and practices to prevent HIPAA violations, right? HIPAA violations can cause not only a significant fine from the U.S. government, right, but also a lawsuit by the patients. So that's really the big thing. I think we should, as physicians, be very keenly researching those types of things before we get too excited about how AI can help our practice. But once you get past that, and that's all implemented with certain guardrails and backstops and redundancy to prevent any leakage, of private information. I think it's great, and I think we're already seeing this right now. For example, I have an EHR, an electronic health record, that has an AI scribe. It listens to my conversations with my patients. Of course, I tell my patients before I turn it on, and I get their consent. And so that AI is all HIPAA protected. It's all within the EHR. They have all types of mechanical and information technology guardrails, right, to prevent any leakages of our conversation, right, or maybe the faxes that come into that patient's record. That's all HIPAA protected through that EHR, and that's like the ABCs, right, for an electronic health record. They need to have that, and as they start to implement AI tools, that's really kind of their first question. Is this HIPAA protected? Does this have the proper requirements in place? So I hope that helps. I know that was it's not kind of the sexy latest and greatest treatment in medicine, but it's something that as a physician we think about because it's pretty important, right? So I hope that helps. If you have any questions, contact me at olympicconciergemedicine.com, and you can scroll to the bottom, find our email us, give us a call, and happy to help you. Okay, take care. Bye-bye.